Hey everyone, thanks so much for joining us here today. We have your favorite person back on from Quantum Health, Chris Reed. Chris, excited to have you here. We're going to talk one of your latest reports. This is what we had you talk about last time, but a different report, right? Always a pleasure to have you here.
Yeah, appreciate it. Thanks for having us.
Absolutely. Just kind of as a lead in, right? Healthcare benefits are obviously one of the most important parts of an employee's compensation, and um, one of the most expensive for not only the employee but also the employer. I think no matter where you're in, what industry you're in, most people understand that part, right? Um, and while the average employer offers around 30 to 40 different benefits programs to their employees, the percentage of employees actually using them is staggeringly low, less than 5%. That was actually something I didn't realize until started digging in as well, with the notes that you guys provided and that you continue to put out. But not only does that mean that employers are missing out on the opportunities to make these smarter healthcare decisions, but now they're losing healthcare dollars by these employers are losing healthcare dollars by providing an experience that doesn't necessarily drive any results. So what I want to focus in on today is your recent initiative around employee engagement with healthcare benefits. And let's first start by having you tell us about that recent initiative, and then maybe if you want to also include how does Quantum Health define engagement, I think that'd be very helpful.
Yeah, happy to do that. I guess to start off, as we all know, outside of payroll, healthcare benefit costs are among the highest, largest expenses that employers are facing. And it's really hard to think of an industry that's more complex and confusing than healthcare. And so when you think about that in relation to our current inflationary environment, the family premiums are rising. And so employers are really want to make sure that their employees are getting the most out of their benefits. They want to get that return on investment. So we recently did a study with the Employee Benefit News to find the ways in which companies and benefit professionals prioritize, drive, and evaluate their employee engagement with their health and healthcare benefits. And what we found was that about 2 out of 3 benefit professionals agree that engagement is a top priority, but about 80% of those benefit leaders state that engagement is not where they'd like it to be in relation to their healthcare benefits. And so that same survey also found that employers report that healthcare navigation services from an independent provider are really effective in increasing engagement with health and healthcare benefits, while less believe that a carrier tool could achieve the results that they need. Um, and so when you think of how Quantum Health defines engagement, I think I'd like to start with, again, reiterating healthcare is so complicated and there's so many benefits and point solutions and ecosystem vendors that an employer and an employee going through a healthcare experience has to think about. And so that right navigation partner is going to simplify that entry point into a single point of access. And to do that, they really have to take on all of the member services, all of the provider services, the care management, the utilization management, and really be that one-stop shop, that one phone number on the ID card. They have to simplify the model. And so the right partner is going to integrate with the entire ecosystem. They're going to guide members to the right resource at the right time. And this model builds trust with members, and it allows for earlier intervention and guidance that ultimately streamlines the member experience and drives efficiency in the system. And that's what provides an employer with that ROI that we talk about. So with that context in mind, at Quantum Health, we define engagement as a meaningful interaction with a member, their provider, or a partner that creates opportunities to impact the member's healthcare journey. And so how we engage with the member, that could vary. It could be a phone call, it could be an email, a text, secure message, chat, or a digital interaction. Whatever that modality is, there has to be a healthcare journey indicator and there has to be an action associated. And so I think what I'm particularly proud of at Quantum Health is that not just what our definition is and raising the industry standard, but what's not included in our engagement definition. On the digital front, what we see a lot that's commonplace is in the industry is counting things like registrations, logins, or broad awareness communications on those digital portals. But none of that would meet Quantum Health's criteria for engagement. You also see a lot of broad-based communication. Sometimes you still see snail mail out there, mailers, and any of those kind of things. And none of that would meet our criteria for engagement. It needs to be personal. It has to provide an opportunity to impact the member journey. And so I'm really proud of Quantum Health for continuing to set the industry bar high.
Chris, you hit on something I wanted to tee up to a little bit, but let's go into it a little bit more if possible. Um, where are those opportunities to impact an employee's engagement within the healthcare journey? I know you kind of hit just naturally talking about it, but if there's any other ones, I'd love to dig in further.
I think one thing that doesn't we don't spend enough time on is that engagement doesn't only matter at the member, but when you're thinking of navigation, what really matters is that engagement with the provider as well. What's unique about Quantum Health is that we take on the hard stuff. We know that engaging with a member is really critical to the healthcare journey, but it's also important to communicate and coordinate with their providers. And that's really what makes us stand out. We've heavily invested in making the provider experience easier. So every time a provider calls in and checks benefits for eligibility, those are opportunities for us to know that a member is entering a healthcare journey, and it's an opportunity for us to impact that healthcare journey. So back to our definition of engagement, that it makes a lot of sense to think about those provider calls. More than half of Quantum Health's engagements are in supporting the providers on behalf of those members. And that's super critical in any healthcare journey. Providers connect with us to confirm patients' eligibility and benefits, to submit authorizations or pre-certifications. And the interactions we have with them, they often give us an early indication that someone's entering that healthcare journey. A lot of times that will happen up to 100 days before the industry would otherwise know about a particular healthcare journey starting. So that same concept of real-time interception really puts us in front of that healthcare journey long before a claim would be filed, and a more limited service model would kind of be aware of it. So it allows us to educate members and be there for those critical decision points earlier in that healthcare journey. And again, I think those provider engagements are so critical for that reason. So also helps a lot for higher risk employees. It can help us identify gaps in care as we partner with the member to understand their provider care plans. This approach also leads to fewer emergency room visits, lower hospitalization rates, increased preventive screening, and making sure employees are receiving the right care at the right place at the right time.
Now, Chris, how are you addressing this new definition of engagement with your clients?
Really a pretty simple two-step process. I mean, I think the first step was making sure we invested in our navigation platform, and that we're able to track this enhanced engagement. And the second is to incorporate those enhancements into our reporting and our market message. And so, like I mentioned, Quantum has heavily invested in our digital platforms, specifically our digital member experience and our provider portal, which is really paired with AI support now as well. And so this continues to enhance our expertise of the healthcare consumer journey. And what it does is it allows us to break down the actions and the engagement on our member and provider portals so we can better understand those member behavior trends and articulate that back to our clients. It also allows us to paint a more holistic picture of that overall member experience, that holistic view of a member journey. So when an HR manager is sitting across from their C-suite partner and they're making the case for enhancements to their health and benefits plan, what we find is that conversation always comes back around to two topics, and that's your return on investment and your engagement. What we know at Quantum Health is that we engage with 56% of all covered members. And that includes spouses, that's children's, that's members with no claims, and all others. It's every belly button on the plan. We don't play any games with our engagement numbers. That 56% of covered members account for 89% of all claims paid and 71% of all employees across our entire book of business. And that's 500 employer clients. That's over 3.1 million member lives. And what that results in is 104 million member interactions last year alone. And for perspective on real-time interception, we engage with about 91% of members with $10,000 in paid claims or more before their first month of $1,000 in paid claims. And when you bump that up to a $50,000 threshold, so does our engagement increases as well, up to 96%.
Now, Chris, I guess now when a CFO or a CHRO asks the question, what value will we get from this additional benefit? And the benefit manager replies, we believe these investments will drive more engagement. We can now drive new expectations. Is that what you're seeing? Is that what they're going to say?
Yeah, without a doubt, without a doubt. Yeah, we're setting a new standard and challenging the industry and elevating client expectations. This allows us to strategically partner with our HR leaders and their consultants and helping our client organizations get the most out of their benefit strategy. And really, we do that by better understanding the healthcare consumer and how they engage with their benefits. So it's hard to imagine a better partner strategically aligning around their goals and priorities for their healthcare benefits.
I love it. What's kind of next, Chris? I know you like to do these reports. Like, is there anything, without giving away too much, are there any areas like top of mind for what's upcoming for these reports that you can share? If you can't, just say you'll see.
Yeah, no, I think we're looking at a lot of really fun things. We have a really strong leader in Shannon Skaggs who's very interested in generation AI. So we're excited to see how that can help improve not only the warriors and their experience in helping members, but also in our client reporting. Um, we're looking at solutions for tackling unit cost increases that we're seeing across the industry, and piloting some unique approaches to emergency rooms, which we're seeing a lot of those satellite offices are driving up a lot of costs for our clients when there's better places of service. So we're doing a lot of fun things here at Quantum, and we'll be excited to be back in touch with an update here soon.
Love it. Chris, always a pleasure chatting with you. Can't wait for future conversations and updates. And thanks for joining us here today.
You too. Appreciate your time. Thanks, Jared.